Okay, everybody, let's dive into this case scenario, take a look at it, and let's see where it goes. So here we have Roy. He's 28 years old. He's a male who dresses as a woman, makes a living dancing in a bar as a drag queen. So here we have right in the very first sentence a few different clues that's going to take us right into several diagnoses that we probably need to begin to consider. First of all, we see that it identifies Roy as a 28-year-old man, so that we know he's an adult, and we are going to say that, given this, that he's a biological man who then dresses as a woman and makes a living dancing in a bar as a drag queen. So we see that biological male, he's dressing as a woman and working in a bar as a drag queen. So that's pretty significant right off the bat. This, if we're just going to use this very first kind of sentence to begin to kind of come up with a series of differential diagnoses, one certainly could be on the top of the list. I mean, when a person of one sex, particularly a male, is cross-dressing or dressing as a woman, certainly this could be along the lines of transvestic disorder. We also have, this could lead us down the road of something to consider as far as gender dysphoria. Okay. And, we can look at possibly some sort of fetish type of issue that he might enjoy a certain type of sexual activity. So these are some things that we may want to consider kind of right off the bat, given this very first sentence in the scenario. So here he is working as a drag queen. And then it's going to give us here, as a child, he remembers preferring to play with girls. So it gives us some context of the childhood that this appears to have started long ago. He's 28 now. He remembers as a child preferring to play with girls, which, give or take, childhood, playing with the opposite sex, kind of, that's well within the norm. In games, he often played the role of a girl, the nurse helping the male doctor, or female patient being examined by the doctor. So here we get some more context that not only did he prefer to play with girls, he often played the role. He often played the role of a girl, the nurse, or a female patient being examined. So we have a few different things that not only, as I said, playing with the opposite sex, that's one thing, and that's well within the norm, but taking on this word here, playing the role of the girl, and, whether it's a nurse or female patient. So we're talking about actually a role here of potentially wanting to be of another gender. So let's see where this goes. Again, this is him remembering as a child. So it looks like as he grew older, he began secretly dressing in women's clothing and imagining himself as a woman. So we have a few more items here: secretly dressing in women's clothing, and then imagining himself as a woman. And I'm actually going to change this a little bit. Certainly this is, as far as symptomology, really taking things to a different level. So, secretly dressing in women's clothing, that certainly can go along the lines of kind of potentially kind of transvestic type of disorder, or even fetishism, enjoying or being sexually aroused by material and dressing up in the clothing of the opposite sex. So certainly this is pointing back to kind of these different areas here, but the certainly the criteria that's most kind of interesting and the most significant, I'd say, in this sentence here is imagining himself as a woman, and that that certainly takes this more in the direction of a kind of gender dysphoria rather than a male who's become sexually aroused dressing in women's clothing, and that's kind of part of transvestic or fetishism. Imagining yourself being a of the opposite gender, that's a whole new thing, and that for me is really taking us down kind of a gender dysphoria type of pathway. So it says that he would often push his penis and testicles out of the way between his legs and masturbate by rubbing his perineal area while fantasizing that he was a woman having sex with a man. So we have a lot there in this in this one sentence, in these few lines here. So we have a few different things. Number one, that the idea that he's kind of wanting to kind of change the way he looks or change his gender, or kind of in some ways kind of get rid of this idea of his genitalia by pushing them out of the way. Then also that taking that to, again, kind of a different level, where then there's this masturbation portion while fantasizing he is a woman having sex with a man. So not only is he kind of not necessarily comfortable or wanting to have his own genitalia, he then kind of recreates or enacts being a female and kind of having sex or performing sex in a way that would be kind of similar to having female genitalia. So we have quite a few criteria here, quite a few symptoms, again, going much more along the line of gender dysphoria at this point than kind of transvestic or fetish disorder, because those things mostly are limited to merely cross-dressing or becoming aroused by whether it's objects, materials, or dressing like the opposite sex. But there's really kind of the desire to be of the opposite sex and no longer have that genitalia and characteristics. That's taken this to a whole new level. So we have Roy found himself sexually attracted to both men and women and had sexual relations with both. So in this case, certainly there's characteristics of being bisexual at this point, although he always, and this is, let's see, although he always fantasized he was a woman during a sexual encounter. So again, this term here, always fantasized he was a woman. So we have the criteria being met here of an individual who is now fantasizing of wanting to be of the other gender. And this occurs, during sexual encounters even. So then it says that when he had sex with women, he imagined that he was having a lesbian relationship. So again, he is certainly imagining himself as a female, and not just as a female, as a woman, but then being in a lesbian relationship. So really kind of living the lifestyle of a lesbian. With men, it looks like he fantasized that he was a female partner. So again, this just kind of reiterates more and more this idea of, and let me just write this down then, these areas here of really desiring to be of the opposite sex or gender. And that is key when a person is now to that point where they want to be, and they're envisioning, they're fantasizing, they can see themselves essentially living that lifestyle. We're definitely in the territory, as I said before, in this idea of going down the road of looking at gender dysphoria, or strongly considering that. Now it says neither type of sexual relationship was entirely satisfactory, because he could not think of himself as a woman during the encounters. So this, I would say this is This is, to me, where we start to get some signs of distress. I would say clinically, that's what I'm thinking and taking from this is, neither type of the relationship was satisfactory, that being the key word, because he couldn't completely think of himself as a woman. So this for me is distress due to kind of gender issues, gender identity, and kind of that incongruence that he's feeling. He began to think about changing his sex. So here we go. He's now taken it to the point where not only fantasy, but now he really wants to change his sex. So he would no longer be, and this is a key phrase here, it looks living a lie. And that's certainly, here we go, that's certainly a key phrase. Going back to this idea of feeling distressed. If you feel you're living a lie and you're wanting to change your sex because you no longer feel comfortable in your own skin and who you are, we've now kind of met the majority of the criteria now for what would be gender dysphoria, or what was previously gender identity disorder. Looks like after high school, Roy got a job as a bartender in a homosexual bar. He continued cross-dressing and continued his cross-dressing and preoccupations with secretly being a woman. So here we go. This is getting back to this idea of distress. So we're certainly going down this road where this Roy is certainly having a very, very difficult time with kind of who he is and who he identifies as. One day at the bar announced a cross-dressing contest. Roy decided to enter the contest, went shopping with a friend to buy women's clothes. Now he's wanting to participate in activities. So he's actually going out in society and wanting to participate. He practiced walking like a woman and learned how to apply makeup. So again, now he's kind of evolving into this point where he's taking on these characteristics, or wanting to take on. Roy won second prize in the contest. Good for him. Good resiliency factor there. That probably boosted his confidence quite a bit. He enjoyed the experience so much that he began to develop a persona as a cross-dressing female singer, and he continued to contemplate changing his sex. So there we go. And we can see that he enjoyed so much kind of this experience, began to develop a persona as a cross-dressing female singer. So let's talk about different diagnoses at this point. So going back to some of the ones that I have written down, let's first look at transvestic disorder. I have the handy-dandy DSM 5TR with me here. We see that there's the first criteria is a pattern of 6 months of reoccurrent or intense sexual arousal from cross-dressing as manifested by fantasies, urges, and behaviors. So that one, I would say, is pretty much there. The next one is the fantasies, sexual urges, or behaviors cause clinically significant distress and impairment in social, occupational, or other areas of functioning. That's where this gets a little bit difficult, because the cross-dressing itself with Roy isn't necessarily the distressing part. For him, the bigger distressing part is living a lie with regard to who he is and wanting to be of the other gender, not necessarily the kind of transvestic trait of wanting to cross-dress and feeling kind of guilt, shame, distress about cross-dressing. This is where things get a little difficult. It also asks to specify whether it's with fetishism, which is this idea of being aroused by fabrics, materials, or garments, or autogynephilia, which is sexually aroused by thoughts or images of self as a woman. So that might be more along the lines. But once again, I think the biggest thing with with this particular case study is that with transvestic disorder, there isn't necessarily the urge to be of the opposite sex. It's sexual arousal from cross-dressing like the other or as the opposite sex or opposite gender. And that's why in this case, I am going to, I would say, rule out transvestic disorder, just because Roy is really wanting in kind of a couple of places. He really feels this incongruence of wanting actually to be or become a female. And that really is the key difference here. And he continued to contemplate changing his sex because he no longer wanted to live that lie. So I'm crossing out transvestic disorder because of those criteria. The DSM goes on in the diagnostic features to say the same thing. When it comes to distress, it talks about a common pattern of behavior is this idea of purging and acquisition, where you'll have typically in males go out and buy spend money on women's clothing and other apparel, and then because of the distress, they'll try and overcome those urges to cross-dress and get rid of all of the clothing that they purchased in this way to relieve them from that guilt and stress. But then they'll go back and acquire more. In this case, that's not the case. It seems like he enjoyed developing this persona as a cross-dressing female singer, with really the idea of he enjoys wanting to be of the opposite sex. So there we go. And then as far as fetishism goes, I would say, again, similar. This isn't necessarily kind of a certain fetishism of, material net or certain objects. He obviously enjoys cross-dressing. He's good at it. I mean, he took second place. But again, it's not necessarily that this is a fetish, that he's only doing it or he's doing it to for only sexual arousal purposes. In this case, it's part of this persona. It's part of him wanting to be of the other gender and not necessarily solely for sexual arousal purposes. So for that purpose as well, I'm going to cross off fetishism as well, or a type of fetishism. Which leaves us then, for me, this idea that I think the most appropriate would be gender dysphoria. So to confirm that, let me very quickly kind of run through some of the criteria just to make sure. So in criteria A in the DSM-5-TR, we have a marked incongruence between one's experienced or expressed gender and the primary or secondary sex characteristics. So in this case, yes, Roy, he is experiencing this incongruence between kind of who he is, his own kind of biological person and genitalia, and that incongruence there kind of really does meet the criteria for A. As far as A1, number 2, a strong desire to be rid of one's primary or secondary sex characteristics because of marked incongruence, and the desire to prevent the development of the anticipated secondary characteristics. That's mostly for adolescents. But again, this strong desire to get rid of or be rid of one's sex characteristics. And that we have too, again, kind of this idea of his no longer really wanting his genitalia, kind of reenacting or preferring or fantasizing of having female genitalia, and even having kind of sexual intercourse in a way that he fantasizes about being of the other gender and having sexual relations in that way. Number 3 is a strong desire for the primary or secondary sex characteristics of the other gender, which it does reference many times about fantasizing being a woman during the sexual encounter. Also, number 4, a strong desire to be of the other gender. And again, it has said that he's contemplated that. He's thinking about changing his sex. Number 5, a strong desire to be treated as the other gender. I would say clinically that's there. He fantasizes and wants to be essentially in a lesbian relationship, and I think that he imagines he was having a lesbian relationship. So That to me says that he wants to be treated as of the other gender, particularly if he was wanting to have a lesbian relationship. And number 5, a strong conviction that one has the typical feelings and reactions of the other gender. So I think this goes, I would say clinically, this goes to that final portion of really beginning to develop a persona of a cross-dressing female, or this idea of wanting to have the typical feelings and reactions. So for me, as well as the other part of really kind of wanting to have the typical reactions of a female during sexual encounters, that for me definitely qualifies for those first 6 criteria. He pretty much meets every one, but according to gender dysphoria for adolescents and adults, he really only needs to meet 2 of those 6. So I named off all 6, and I can pretty much identify all 6 in this particular case scenario. The B portion of the criteria says that it must be associated with clinically significant distress, which I pointed out several times here, that there is this incongruence which is creating distress for Roy. Let's see. As far as that is going, I would say then that this is a case of a pretty good example of gender dysphoria, or at least in terms of this kind of early or later adulthood, where a person has began dressing or cross-dressing, and then kind of really figuring out or finding out more and more that, you know what, he identifies and wants to become of the opposite gender. As far as the specifiers, it's looking here, I don't see this idea of adrenal hyperplasia or those type of conditions. It doesn't mention that in the scenario. That's something that a doctor, a congenital adrenal genital disorder, that would have been probably mentioned in this scenario. And then also this idea of specify of post-transition. So if the individual has transitioned to full-time living in the experienced gender, which is not the case at this point. We see that he's going shopping to buy women's clothes for a contest. He's enjoying developing this persona. He's still considering contemplating, but there's not necessarily this transition to a full-time living. So at this point, and he's not receiving any sort of hormonal treatment or transition surgeries or gender-affirming surgeries, as the DSM states. So at this point, I'm going to put this down then as gender dysphoria, which is F64. So let me write this down. So it's F64.2, which is gender dysphoria of, let me go backwards. I did that wrong. It's actually F64.0, which is gender dysphoria in adolescents or adults. The other code, the F64.2, was gender dysphoria in children. So there we go, F64.0, gender dysphoria in adolescents and adults. Again, I believe that he's met definitely the majority of criteria A, if not all 6 of those. He only needed to meet 2 over the past 6 months. And then it is creating distress, and his desire to be of the opposite sex or gender is certainly the case in this scenario. So this is a great example. This has a lot of kind of the characteristics and symptoms that we should know in these cases.